In August last year, as Melbourne endured its second lockdown, the federal government was already planning the vaccine rollout for the months ahead.
You've described this as a day of hope, Prime Minister, with the signing of this agreement between the government and the AstraZeneca drug company for a coronavirus vaccine.
Well, I am hopeful, but also, naturally cautious. And it is good news. I mean, as people are going through each and every day, dealing with the restrictions, businesses, particularly people down in Melbourne and across Victoria.
The federal government's strategy would rely heavily on the AstraZeneca vaccine.
We're not putting everything in the AstraZeneca basket, but that is the most advanced and the most likely based on the expert advice we have.
Most countries around that time just said, we're going to hedge our bets and have a range of vaccines because we don't know which ones are going to work and we don't know about the supply chain.
We've got a team of 60 people in the health department and another team of similar size around the government who are and a lot of consultants and contractors working on this logistic planning.
How these and other crucial decisions were made has come under increasing scrutiny as Australia's vaccination rate lags behind other countries.
What was being told to us was that when there's a vaccine, things were going to be better.
The government's vaccine rollout has relied on a network of contractors to deliver millions of doses nationwide. It signed a series of contracts with consultants to work on strategic planning, including several with McKinsey & Company, a global management consultancy.
This is core public service business, advising on strategy. The government has been paying millions of dollars to various consultancies to actually together provide advice on what they should be doing.
This year, McKinsey received a $3.8 million contract to provide rollout support services and a $2.2 million contract for vaccine manufacturing advice.
We actually don't know what they produce for the money we're paying for. The reports they make are often secret, so we can't evaluate whether we're getting value for money.
Last August, the Health Department signed a $660,000 contract with McKinsey's Australian arm for vaccine strategy advice. 730 sought that advice under Freedom of Information laws. The response was that McKinsey did not provide specific advice. The Health Department said McKinsey's 4-week contract involved collaboration and participation in a range of activities. The only document provided was this 8-page summary of global vaccine development prepared by McKinsey. The document clearly states it's based on publicly available information and didn't offer any specific advice.
The 8-page PowerPoint is the sort of thing you could download from WHO or other websites. It's fairly basic information, so we don't know if and whether there was any value add on top of that. The amount they were being paid and the 8 PowerPoints are not consistent.
Stephen Duckett from the Grattan Institute has been critical of the government's extensive use of consultants and estimates it would take about a week's work to produce the vaccine summary document.
What we ought to do is have a competent public service that's able to deliver the goods, able to provide advice on strategy in an independent way. Instead, and what we're doing is hiring these consultants costing way more than it would cost if we actually allowed an appropriate staffed public service.
The Health Department says it needs outside advice due to the size and complexity of the program. McKinsey told 730 that it provided more than a single document under its $660,000 consulting services deal, but declined to provide more detail.
Sometimes it's appropriate for consultants to actually attend meetings and just be a member of a committee. Providing verbal advice is now very common.
The Health Department said McKinsey did not provide advice on vaccine sourcing and that its FOI response to 730 did not reflect the level of work undertaken by McKinsey.
We absolutely ought to have transparency about every aspect of COVID, and we don't. And in particular, we ought to have transparency about how decisions have been made, who was involved in making those decisions, what the evidence base is for those decisions.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.